and we've been conversing for 200,000 years. We've only been building apps for about 10. So I think the design of conversation is something that comes to us much more intuitively. Also, we know that it's helpful to talk about things when you're in a difficult spot. So it's also helpful because it allows you to get something off your chest. Literally, you kind of externalize what's happening. And then, this relational agent is able to empathize in return. And so even though there's no person here, which might encourage you to share, you still have that moment of vulnerability. You still need to feel heard, to feel understood, and that is really one of the major functions of empathy. And so we still have to empathize really well and demonstrate deep understanding, empathize authentically, not pretending to feel either. So it's a bit of a delicate balance.
And now, from San Francisco and the UCSF Rosenman Institute, the Health Technology Podcast with your host, Christine Winoto.
Our guest today is Alison Darcy, founder and president of Woebot Labs. Woebot is a relational agent that helps people manage mental health challenges such as depression and anxiety. Available for free on the App Store, Woebot's mission is to make mental health care solution radically accessible. Alison's work with exploring digital treatments began when she created one of the first online support groups for people with eating disorders. In this episode, she reflects on the power of technology to empower patients and caregivers outside of the clinical setting. We discuss the value of AI mental health support as a tool for breaking barriers of access and stigma. Here's our conversation. Welcome, Alison. It's so great to finally meet you in person. We speak a few times before over the phone, but I thought it's funny that we finally see each other in the Zoom. Thank you for joining me this morning.
Thank you for inviting me. It's a real pleasure to be here.
Yeah, so I love that what you put on your LinkedIn is that made a robot that helps people feel happier. And we all need a little bit of that these days. So I've been following Woebot for, the past, 3+ years when you just started. So it's amazing to see the progress that you and your team have accomplished. I think that's really impressive.
Thank you.
But before we start, I thought we can talk a little bit about your background. You had quite an interesting career path. I thought, by the way, we have a shared experience that we both work for investment banking in London.
Wow.
I was in the city. I was in the Liverpool Street Station. You're in Canary Wharf.
Wow, I was. But before that, I was Old Broad Street, which was Liverpool Street Station as well.
Great.
Yeah, right beside the stock exchange. Yeah.
So that's interesting. But I thought it was interesting. You studied psychology as your undergraduate, and you were working as a software developer.
Yes.
And then you moved back to academia and then straight through academia and then start a company.
I did. I don't want to blame investment banking for sending me back to academia, but that's kind of how it happened. No, that's interesting. No, I actually always planned to pursue an academic career in clinical neuroscience. Yeah, clinical neuroscience. And I actually had a place in London for postgraduate study. And I decided to sort of take the year off or 2 years off and get a job and do a little bit of traveling before I did that. And so I taught myself to code and got that job in an investment bank. But our investment bank was taken over by a larger one, which sent us down to Canary Wharf. And then we didn't actually have anything to work on, even though we had to arrive at work every day. So it was a very strange time. But it was there where I talked to a friend of mine who was visiting, Jenny Blake, who was one of the co-founders of an Irish support organization for people with eating disorders called Bodywise. And we talked about how they, the challenges of keeping support groups sustainable in, partly in rural areas in Ireland, partly for, population density reasons, but also just the stigma. Everyone knows where you're going when you show up to the community centre at 8 p.m. kind of thing. And we started talking about the idea of an online internet-based support group. And so I looked into it some more, and I fell in love with that process of really going deep into what is helpful about the in-person experience, and then how might you translate that to a digital format, and not just replicate what's there and what works, but also use the digital format to solve some of the problems of the in-person setting, of which there were many. Mm-hmm. And I ultimately co-built that. That was the last thing I ever coded, luckily for the rest of the world. And, but was just fell in love with that process and became, a sort of treatment designer ever since, and went back to study the efficacy of that program, and then went on to, PhD, and where I was building cognitive behavioral therapy in an inpatient setting, and then to Stanford for a postdoc, because Stanford actually there was a few labs there that were just obviously really ahead of the game in terms of the use of digital interventions and augmentations, right, to conventional treatment. And I thought, which I still think, tech is going to really help us solve these problems of access and scaling, rare expertise. And arguably, it's only been in the last 12 months where we've seen such huge progress there. But that was back in the late 90s when I was in the investment bank, showing my age. And here we are, 20 years later, and things are starting to move, and tech has evolved. So the early days back then, it was like the internet is going to solve all of our problems, and then it was mobile, and then it was smartphones in 2008, right when I was starting at Stanford, and then it was big data. Big data is going to solve this problem, and then it turns out that tech is never going to solve the problem. Technology is not the problem. It was a human problem. So it was only until we created Wobot, which is, a relational agent, something that can actually show up like a person can, empathizing, really listening, inviting authentic disclosure, guiding you through an evidence-based technique while you are really struggling, that we found something that is actually, I think, very impactful.
Maybe that's a good segue to maybe tell our listener, what is Wobot and what is trying to achieve?
So Wobot is what we call a relational agent. So we used to say, it's funny, I was just talking to my team about this the other day. It's variably referred to as a chatbot, but a chatbot is really just a kind of an interface for, a specific task. It's really an interface for technology, and that's not really what it was. And then we were referring to it as a conversational agent for so long, because it holds a conversation with you and replicates the back and forth of human discourse, but that doesn't really capture it either. And we just discovered that Wobot actually has the ability to develop what we call a working alliance with users. And so it's replicating some of the unique nuance of human-to-human interpersonal relationships. And so we've officially started referring to Wobot as a relational agent. So it lives on your phone. Wobot is the agent that lives in an app that is freely available in the app stores. And it's also something that Wobot has built we have specialized programs for dissemination with, clinical partners and provider partners and payers and IDNs and things. Mm-hmm. So it's a relational agent that helps people with mental health challenges, specifically those around depression and anxiety symptoms, but through the lens of people's just real lived experience, like what you're kind of dealing with at any given moment.
I used to tell my friend when I first learn about Wobot, it's just like you have a friend who are really a good listener, and very thoughtful. That's what I think of Woebot.
Great. Thank you.
And they're always available for you
Yeah,
24/7. That's
that's
what
right.
I
That's
thought
right.
about what Woebot can be. So I just thought maybe we can go back a little bit, your time when you first started that, the company, the eating disorder, that bringing the in-person treatment into digital. That was a good lesson that it can carry through with when you develop the Woebot. What were the lessons that you learned that the challenges with the in-person that can be solved?
Yeah, well, that's funny. It's interesting. Well, I think one of the learnings there was just for people who are struggling with an eating disorder, there's utility in being able to be present to support one another in a format that doesn't include the body. So that's what the internet-based support group can do, right? You don't have that as a kind of a complication factor. And so it's no way, and when I say this, I don't want anyone to think that it's about replacing what good care is, but there's room for these other media, these other ways of interacting and getting support and providing support, and that are simplified to the point that it enables really good work, because the focus becomes on the work to do rather than all of the other things to navigate. And it's funny, I learned the same lesson too while I was at Stanford on a different research project. I made an internet delivered version of family-based treatment for adolescents with anorexia nervosa. And I was intrigued by some of the massive open online courses, MOOCs, that were just coming on stream, like Udemy, right, and Coursera, of course, being most famous, and others. And there was a lot of aspects of that I thought is incredible. But to me, they were scaling this very specialized education. And I knew the challenge for us at Stanford was, how do we scale this very rare expertise in treating adolescents with anorexia? There's only a handful of labs around the world and treatment centers that do this treatment really well. My mentor had co-developed it, Jim Locke, with Daniel Lagrange at UCSF, but then in the University of Chicago. And so initially I made a program to train clinicians let's scale the training then for clinicians on this platform, which comprised of short videos, some interactive kind of homework pieces to do in between, self-driven in terms of pace of training, and then a forum for people to connect at a peer level. So that kind of was interesting to borrow that from online education. And the model worked so well, I thought, well, why don't we just use this to deliver the treatment itself, where the peer group can be parents? Because one of the things that parents who have a child who has anorexia nervosa go through is just isolation, because they tend not to meet other parents who are going through the same thing because it's so rare. And so it was very significant for those parents to be able to, in an online forum, come together and share their experiences. I filmed Cara Fitzpatrick, just one of the most brilliant FBT clinicians in the world, describing some of the constructs that she shares with parents all the time. And then they met with the research therapist once a week, which was me, 20 minutes a week for just kind of the guidance and the redirection to certain content, and the checking in about how the progress was going. And of course, you would imagine family-based therapy, how can you possibly put that online? That just seems like you must all be in the room. Right. And in this guided self-help version of that treatment, what I noticed was I would be on their laptop, on their kitchen table, in their kitchen. And the cat and the dog would jump up on the lap of the parent as they talked to me. And I was so embedded in their life that, it really worked. There was an intimacy that was created by the tech itself, which is not there in the clinic environment. And the other piece about that was a big learning for me too, was that with this approach to work, what you're really trying to do as the therapist, your role as the therapist is as consultant, and you need to empower the parents to show them how to intervene and how they can re-nourish their child back to health. And the fact that we were not in the clinic setting meant that the parents had no choice but to kind of get empowered, because they had this very short window with the therapist, and the child, their child was not there with them. So there was no ability for them to sort of, rest into the setting and say, see, honey, listen to the doctor. What is the doctor saying, right? Which would actually end up disempowering themselves. So in that context, in this very, early study, it was interesting to discover, no, it actually reinforces the empowerment of the parents in this model. And so I'm happy to say that is research that has continued in Jim Locke's lab, which is brilliant, but just very interesting. Now, this won't be surprising to people in the last year because everybody's learned to use technology in a different way now. But I mean, a few years ago, that was quite radical.
Right. And then people, because how could you replace an in-person?
Right. And it's not about replacement, right? Like I might call my mother on the phone, but there's nothing. I'm still going to see her. I'm still going to visit because I want that in person. There's nothing that replaces that, but they can coexist very well. Just like, now this is not a good analogy. I need to get a better analogy, but I think just like sandwiches coexist with a meal in a restaurant, they're both food, but they're very different. There's very different occasions that a sandwich has some conveniences that a restaurant meal doesn't. Right. And it's a very, it's a different experience, even though they're both food.
Right. That's a good point. And sometimes you do want a sandwich rather than restaurant meal.
This podcast is sponsored by Brown Rudnick's Global Life Sciences Group, a team of legal professionals that help life science companies, lenders, and investors around the world turn good science into good business. Learn more at brownrudnick.com. This podcast is also sponsored by Canon Quality Group. Canon Quality Group has been helping medtech startups set up quality management systems for over 10 years. If you're unsure when to get started with quality management in your startup, turn to the experts at canonqualitygroup.com.
So with that, and you're doing that research at Stanford, and at what and when you realize that the approach with the robot that makes sense, and what kind of patient population that robot can help?
Yeah. I know some journalists always ask, when was the light bulb moment? And the reality of doing this work is that, it's a long time. It's, overnight success, 10 years in the making. But so how I found my way to Wobot was, my work at Stanford led me to sort of larger and larger data sets. And then ultimately, I picked up the phone and called computer science across department and looking for Andrew Ng to see if he would be a consultant on one of my grants. And we just started talking, and Andrew is one of the world's leading experts in AI and particularly deep learning. And we found there was a lot of intersection. And then more formally, I ultimately went over to his lab and ran his health innovation group, where we, with some of his grad students, looked at the intersection of the two fields. But it was really good product practice and prototype testing of key assumptions over and over and over again. That ultimately led us to Wobot. I had thought about this idea of something that actually converses with you, and but it wasn't until the technology got to a specific point where the tools we could use, we could really make a prototype that had reasonable fidelity, that I was able to really look and see what the effect would be. And Wobot was a one prototype alongside 14 or 15, but I immediately could see that this was behaving really differently, that people were orienting to Wobot really differently than anything I had ever been involved in before, to the extent that some said, you know, Wobot, where were you? I need you to check in with me every day. And because we weren't sending, you know, push notifications every day. And I thought, wow, I've never been upset about not getting a push notification. But they were referring to Wobot as a person. And, you know, we're kind of, and you could tell that people knew it's a chatbot. It's not a deceptive thing, but they were going along with it. And it had this playful side to it, which is really interesting because, you know, when you think about a therapeutic process, you're also trying to invite people to think differently about their existence, to sort of pause for a minute and kind of, you know, experimentally lean into the potential alternatives and things. So it was a really nice parallel, but that's how we ultimately got to Wobot. And then we quickly built a research version, and I collaborated with some former colleagues, and we ran a randomized controlled trial among young adults through a college portal, a Facebook. We recruited on a Facebook page, an alumni page from a New York, a university in the New York area. So they were not Stanford students, who are widely regarded to be anomalous. So we, and we were just very encouraged by the results. We were very surprised to find that in 2 weeks, you know, we could significantly reduce symptoms of depression relative to a psychoeducation only support group. And it was no, please.
I'm just thinking, do you think it's because the society now is used to texting with people, like it's a form of communication?
I think so. I think, yes, which is not a new thing, right? I think what's nice is that technology, in some ways, certainly the technologies that we're using are getting simpler and simpler. And a text-based technology, it's just conversation. And we've been conversing for 200,000 years. We've only been building apps for about 10. So I think the design of conversation is something that comes to us much more intuitively. Also, you know, we know that it's helpful to talk about things when you're in a difficult spot. So it's also helpful because it allows you to get something off your chest. Literally, you kind of externalize what's happening. And then, you know, this relational agent is able to empathize in return. And so even though you know there's no person here, which might encourage you to share, you still have that moment of vulnerability. You still need to feel heard, to feel understood, and that is really one of the major functions of empathy. And so we still have to empathize really well and demonstrate deep understanding, empathize authentically, not pretending to feel either. So it's a bit of a delicate balance.
Yeah. And also, how does it, I mean, the robot needs to be smart enough to give something, because you cannot program everything, but I think they have to know a bit your specific problem, that they feel the person felt that they're being acknowledged rather than just generic response, right?
That's right.
And how do you ensure that?
Good old fashioned talking to people. So whenever we build for a specialized population, for example, we've done a lot of work in postpartum depression, and it was just a lot of talking to women who have gone through this and are going through this to understand what their lived experience is. And I think that combination with, you know, while delivering, you know, some of these evidence-based approaches is really crucial. You know, we had to understand that, you know, actually 80% of the conversations that postpartum women have with Wobot are occurring between 10 p.m. and 5 a.m. Mm-hmm. So you have to imagine, you know, what's going on at that point. And, you know, mom's alone, right? And sometimes mom's alone with baby, and that provides an opportunity and also, you know, a challenge. And, you know, you can be up to their elbows in diapers, right? So it was about just understanding the reality. And, you know, some of the things that we learned were things like the stigma that surrounds postpartum depression, for example, how important it is to normalize, because women don't necessarily, it's really hard for them to share with other women what they're going through. And it's not something that's really talked about as much as possible. Now we've made great progress in people like Meghan Markle and other people are like now more forthcoming about their experience, which is so important and so brave. But it's still fairly stigmatized. And I think things like, challenges with bonding with your baby, it feels very primal. And so Wobot responding with like deep understanding about what that feels like and acknowledgement that, they're not alone and they're not broken because of this. Those are the kinds of, really nice methods of normalizing and just empathizing and showing understanding that we've done. So it really does take a lot of, just like any good therapist, right? You just have to talk. They gain a lot of experience from talking about it.
And I think one thing that I thought was interesting about Wobot, not only the robots trying to understand, empathize with you, but also come up with suggestion on how to, I want to say, fight your thinking, or it help you shift your thinking as an exercise.
Right. Well, I always thought that was one of the most interesting and empowering skills that you can learn in cognitive behavioral therapy, challenging your thoughts in a way. But I always felt that the tools available were so limited. And that was one of the key innovations I think that we had with Wobot was, can Wobot show up not just like in a therapeutic way, but how can Wobot also be the tool that allows you to challenge your thinking, but in the moment where you're actually experiencing a lot of negative self-talk? Because that's the irony about mental health, is like, that's when we need you to, practice the things that you've learned in therapy, but it's also the hardest time to remember to do anything that's good for you. By definition, when you're upset, where you don't have the same cognitive capacity as when you're well. And so that is something that Wobot, I think, does particularly well, just guide somebody through that process of challenging their own thoughts. And I think it's pretty powerful.
Yeah. So I know, people sometimes think about robot, it seems like such a cold beings. At the same time, people can open up to robot better because they feel like they're being less judged. And I thought that's an interesting, dilemma or,
yes.
And what do you think about having a real robot, like being in a home with a patient who fight for loneliness or other depression? What's your thought on that?
The embodied robot question is really interesting. We chose for Wobot not to have an actual physical presence, because for us it's about, Wobot literally being with you as you live your life. And there's also a little bit of Wobot as a tool, with, truly utilitarian, just like, and I think about this, like, sometimes I use this analogy too, Wobot as the mechanical tennis ball machine, right? That helps you practice your swing and gets you better for the actual game with an individual person. I think there's people are concerned about sort of unnecessary or attachments that are real and replace those that are between humans. And I just don't see that we tend to not see that either in our data. Like, no more than you would be concerned about people becoming really attached to the tennis ball machine and then stopping to play real games of tennis. That's not what it's for. Wobot encourages people to externalize, and it gives people practice with getting something off their chest, having it heard really well and deeply understood, and going through the actual practice of challenging their thoughts or whatever other, wellness practice gets you through to a place of feeling well. I mean, that's really what we're trying to accomplish with a good therapeutic approach. It'll never replace human connection. And, but, so that's why we chose Wobot. And I'm not really answering your question about embodied robots, but, I know that there are some people that are building those, and there's some of them are pretty sophisticated, but I see Wobot in a very, very different light.
Mm-hmm. Okay. I know that we're about to be short on time, but before you go, I want to make sure I capture what are the top 3 lessons that you learned with starting Wobot? You can do more.
3 lessons. That's good. The top 3. The first one is, everyone says it's hard, but that just doesn't capture how hard it is. There's a sign in the bathroom of my local restaurant that says, the only thing more overrated than natural childbirth is owning your own business. So no, it's very hard to create a startup, but it's supposed to be. That is the challenge, and you must lean into that, because nothing worth doing is easy. And I know that sounds like a cliche, but the very painful lessons, they are painful for a reason. And that's really where something genuinely innovative, that's where it comes from. It is a struggle, but it is absolutely supposed to be a struggle. So just lean into that. The second piece of advice I would have is talk to people. Just talk to people. It's the most simplest thing, but talking to humans is the biggest weapon you have, the biggest, source of inspiration. And if you're struggling what to do, you just ask people. You go to the people, always go to your users and go to your customers, go to the experts, constantly talk to humans. And then the third lesson I think I would have is, don't think you need to do everything on your own. Just hire a great team around you. That's what it's all about. Hire people smarter than you, and try and have fun while you're doing it. They are the 3 lessons.
I think that's important. That helps with the difficult part of the journey, right?
Exactly.
If it's
right.
fun,
that's right.
At least you can get up in the morning because it's something you look forward to.
Absolutely. No, that's absolutely right. And it's so worth it. The struggle and the painful lessons and things, it's so worth it when you get a chance to work with really smart people that you genuinely respect. And it's very humbling to think, wow, I founded this thing, and look at these people who are now, with me at the table trying to make it real. That's very humbling and very, very, rewarding. But also very rewarding for all of the challenges too that you face along the way.
Yeah, I think that's what makes it rewarding, the whole complete thing. It's not just a good thing, but it's also the hard part too.
Absolutely.
That's life, I guess.
Right. That's life. That's right. That is life.
It's great. Well, thank you so much for your time. It's really fun to learn so much from you and your story. And looking forward to see what the next thing that Wobot can do.
Thank you very much for having me. It's really been a good time. Thank you.
Thank you for listening to another episode of the Health Technology Podcast. We want to thank our executive producer, Herminio Neto, our content writer, Kelly Muscat, and our podcast engineer, Andrew Rojek. If you enjoyed this podcast, be sure to subscribe and leave a review. The Health Technology Podcast is available on all major platforms.